Welcome to Part 1 WSIC Population Health Hypertension Dashboard demonstration video. WSIC primary and secondary care users can access the Hypertension Population Health Dashboard from the WSIC homepage by clicking on the Population Health product and then on the BP Reader icon. Using the icons, you can go to the landing page or to another section of interest. The WSIC Population Health users can find the Hypertension Population Health Dashboard under Long-Term Condition Population Health category of products. Hypertension affects 1 in 4 adults and is one of the biggest risk factors for premature death and disability in England. The WSIC Hypertension Dashboard was designed as a tool to improve management of hypertension and associated health outcomes. The slide shows examples of clinical uses of the WSIC Hypertension Population Health Dashboard. We are now on the landing page, which gives a breakdown for the whole North West London population in a context of the hypertension. The hypertension is defined based on a QOF algorithm. The dashboard has been split into 4 quadrants. Let's start from looking into the population overview dashboard. This page provides a breakdown of North West London hypertensive patients by various criteria. Number of hypertension patients by geographies, such as health borough, PCN and practice, by age and gender, deprivation and ethnicity. You can decide if you would like to view detailed ethnicity or summary ethnicity. Hypertension diagnosis over time graph allows comparing number of hypertension diagnoses with number of comorbidities diagnoses, such as coronary heart disease, CKD, stroke, TIA and heart failure. Use the filters at the top of the page to identify particular cohorts of patients. This will update the graphs below and total population, which is displayed at the middle section. Please note that we have recently enhanced this dashboard with additional filters such as housebound and homeless. For detailed information about codes and logic used in the dashboard, please refer to the calculation definition section of the Hypertension User Guide, which can be found on our website. For the purpose of this demonstration, I have selected older people with dementia or advanced Alzheimer's disease who are housebound and who have home blood pressure monitoring. All graphs are now reflecting my selection. The dashboard is interactive, which means that by clicking on a selected bar will update others accordingly. To reset the view, click back on the segment. Users with the PID level access can view the list of the patients based on their filter selection by clicking on the list icon at the top right. Hover over the eye icon to find out what comorbidities are taken into account for the Count of Comorbidities column. Clicking on the blue arrow will allow you to see an individual patient's activity summary page. To return to the Hypertension Population Overview dashboard, click on the arrow icon. If you would like to return to the hypertension landing page, please press the home icon. We are now back on the landing page and will have a look into the population comorbidities, complications and risks dashboard. This dashboard shows the North West London hypertensive population broken by comorbidities, complications and risks. As usual, the graphs will reflect your filter selection. You can, for instance, decide that would like to focus on North West London patients who had their blood pressure measured at home in the last 12 months' time. The row below the filters is now displaying the total number of patients who had their blood pressure measured at home, number of hypertensive patients, and hypertension prevalence in percentage. Below there is a further breakdown of the patients based on your filter selection and by age bands categories. As I have selected 12 months in here, the dashboard now shows the number and percentage of the patients who had a BP measured at home in the last 12 months' time. Further down, we can see the breakdown of the selected patients cohort by the latest blood pressure reading, chronic kidney disease stage, latest eGFR values, and at the very bottom, we will be able to find out how many patients based on our initial searching criteria suffer from any of the 9 listed comorbidities, complications, or risks. This dashboard is also interactive. Clicking on a selected bar will update others accordingly. For instance, clicking on the bar showing patients suffering from the heart failure will amend other parts of the dashboard accordingly. To reset the view, click back on the segment. Users with the PID level of access can view the list of the patients based on their filter selection and access range by clicking on the list icon at the top right. The last dashboard within the population segment is the map. It presents the distribution of the Northwest London hypertensive patients by LSOA and by the number of criteria listed in the top row filter section. For the purpose of this demonstration, I would like to find out a distribution of the housebound hypertensive patients by LSOA. The map is now reflecting my filter selection. The darker segment's color, the higher number of the hypertensive patients reflecting my searching criteria living in that particular LSOA. By hovering over the segments, I can find out the exact number of the hypertensive housebound patients who live in that area. Again, users with the PID level of access can view the list of the patients based on their filter selection as well as the access range by clicking on the list icon at the. Thank you for watching the first part of the WSIC Population Health Hypertension Dashboard demonstration video. The second part can also be found on our YouTube channel. Dummy data have been used throughout this demonstration video. To request a WSIC access or provide a feedback, please email nhsnwl.wsic support@nhs.net. Thank you for watching.